Hi, and welcome to another instalment of this series on ethics. Today, ethical issues in public health. But first, what exactly is public health?
I'm not too sure really.
I have no idea.
I've never heard of it. Public health is the science of understanding factors that influence people's health. Its focus is in prevention of disease states and leads to the formation of many policies. But how do these policies affect us, and what are the ethical implications? Well, the Nuffield Council recently published an intervention ladder. Each step of the ladder describes a different level of public health intervention based on its level of intrusion and comes with its own ethical issues. Let's take a closer look at some of these. Smoking cessation programs is one type of intervention. NHS Tayside is one of many trusts rewarding pregnant women who have quit smoking with grocery vouchers. But is this use of taxpayers' money fair? Joining us now is Felicity Burbage from NHS Tayside. Hi, Felicity.
Hi, Mike.
Many people are clearly angered by this scheme. What would be your response?
Well, when you consider that in 2007, 107,000 people died of smoking-related diseases in the UK, at a great cost to the NHS, I would argue it's our duty to cut this number. The UK government has already banned smoking in public places. Our incentive scheme stops the feeling of exclusion placed on smokers and encourages them to quit rather than forcing them.
But is it not true these schemes cost the British taxpayer £21.4 million in 2008?
It sounds like a lot, but these schemes have proved to be very cost-effective and saved many lives. They also have a limited level of intrusion. I think the bigger ethical issue with smoking that is never considered is that the government pulls all the strings with regards to smoking deterrence. Sceptics would suggest the £8 billion in revenue they receive each year through smoking produces a massive conflict of interest that's preventing the government from introducing more incentive schemes like the ones we run.
I think the question still remains, in these money-stringent times, is it ethically correct that people's autonomy is skewed by monetary incentives? But Felicity, thank you. Next, we have the ethical issues regarding vaccination. Joining us now is Francis Ford, an ethicist from Liverpool University. Welcome, Francis.
Hi Mike, great to be here.
A lot of activity on our Twitter feed regarding this topic, so let's get straight to it. What are the main ethical issues we need to consider?
Well, there is a cost-effectiveness issue, but more important is the ethical issue surrounding personal liberty. Currently, many vaccinations in the UK are opt-in schemes and none are compulsory. There have recently been calls to make them compulsory to help safeguard the population.
And what do you mean by this?
Vaccinations clearly provide personal immunity to certain diseases, but a greater goal is to produce a population immunity to protect those who cannot safely receive the vaccine. Allowing people to refuse life-saving vaccines stops the possibility of disease eradication.
So you're suggesting vaccines should be made compulsory?
For some diseases, yes. In the wake of the MMR scandal, vaccine uptake rates have dropped. This is correlated with a 36% increase in rates of measles in the UK in 2008. We cannot allow this to occur.
John James on our Twitter feed has said, what about people's right to choose? How dare the government force us to put foreign chemicals into our bodies?
It is important here to consider that the majority of vaccines are given in the early stages of life. And again, to use the MMR scandal as an example, parents are refusing to accept the vaccine for their child due to their belief in an entirely fictional link with autism. I would argue it is ethically wrong to allow a generation of children to suffer as a result of this.
Let's take another Twitter comment. Patricia Hughes says, how can you force people into accepting vaccinations when long-term complications are not always known? The MMR autism link may have been a flawed argument, but you can't pretend the medical profession has never made a mistake regarding long-term side effects of certain interventions.
Look, medical interventions work on the basis of the best evidence base. We cannot risk the lives of children and prevent the eradication of certain diseases because of a parent's misguided autonomy. We need to ensure the work of one person does not risk the lives of an entire population. Andrew Wakefield placed the seeds of doubt in the minds of many parents. We have an ethical duty to stop this happening again.
Thank you very much, Francis Ford. I'm afraid we're out of time today. Other ethical issues we could have considered include the lack of consent in fluoridation of water and forced isolation of infectious disease patients. But to leave you with one key question, should the moral and ethical objective the government has to ensure the health of the population and maintain the social good be placed above the right of autonomy? Join us again next time for more ethical debate.